Wendy and Noam and Felicia for all their help getting this report together. So you all know what the charges were, and we were the individual group asking what are the biggest gaps in measurement obstacles and ways for improving measurement and data integration at the individual level. And just to kind of set the stage for our conversation, we talked at the beginning just about how we're struggling with the fact that you've got a child going to an adolescent, going to a young adult, and those developmental changes that are happening over time have challenges for measurement just to begin with. And also that children sit within families and sit within systems, which others of you were addressing, and then within communities. And we also used this schematic about the types of measures we were talking about to say we were looking both at strengths and needs, as well as services and processes and outcomes, and that some of the tensions we face are measuring behavior versus diagnoses, and patient-centered versus what's often easier to collect in our settings or in the research process. And then we discussed a little bit about whether the use was for clinical decision-making at the individual level within the context of a research study or policy setting. So we first talked about gaps in measurement, and we started with the strengths and needs area and came up with several domains. So we felt there were a whole series of things related to families that were critical to be understanding: family structure, parental mental health, et cetera, that we also felt a focus on strengths was important, the child's strengths as well as the family's strengths. We felt adversity was critical to be measured, and some of the things that were brought up were the ACEs checklist, so the Adverse Childhood Experiences checklist, checklists or other mechanisms for identifying other risk factors like poverty. The concept of biological susceptibility came up, and how that will be measured and how individual level markers related to that will be needed to be incorporated into decision making and into data sets. And then we talked a lot about preschool and school data being critical to integrate in a number of different sectors work, because so much of that data gives you a barometer for how the child is doing socially, as well as academically, cognitively, and emotionally. We talked less about kind of gaps in measurement at the service process level, but focused a lot on the critical role for a team approach and finding ways of measuring that, and that included both co-location and coordination of care. And then we talked about kind of what are brief, simple outcome measures that get at key principles, and we gave as an example: is this child on a trajectory to graduate from high school, or have they graduated from high school, as an example of a very simple but powerful outcome measure. So that was our discussion on the first question, gaps in measurement. We also had some big issues that kind of paralleled those domain conversations we were having, and one was feasibility in primary care, although I would argue that would go to other sectors as well. But the comment that came up was that the measures have to be feasible and usable in a service setting. They cannot be lengthy or difficult to incorporate into what you're doing. And I think that would be important for other systems as well. Another issue was the ability of measurement to cross-talk across systems. So not just does the data crosstalk, but do the domains crosstalk across systems. The developmental challenges that I mentioned earlier of how you measure social emotional in a child at one age is different than how you measure it at another age because of their developmental age. Who is the respondent also varies, from the parent being a critical reporter early on to the adolescent and young adult taking on greater roles within that. And a major issue that came up was public domain. If things aren't in the public domain, it's much harder to be able to integrate them into care processes, no matter what sector you're in, but also into data systems. We then moved to obstacles to measurement and integration. Data regulations came up, HIPAA and FERPA, and is there a way to work around those or put some parameters around what are opportunities where that kind of data can be shared. No surprise, data systems that can't crosstalk came up. We were also very aware that we have the same issue at the research level that we have at the clinical level, and that with studies that come out, we are not using comparable languages or measures, and the proprietary nature, not fiscally, but in terms of disciplines or in terms of factions within groups about this is the way this should be measured, and that we really need to move towards more systematized, standardized, agreed upon measures in research as well as in policy and programs. And the importance of measuring fidelity to what's being implemented. We talked a lot about developmental changes, and this includes legal rights with respect to accessing data, including youth who are aging out, and the fact that a number of mental health crises often occur as a youth is aging out and losing services, or as a parent, as a person who can comment on the youth's mental health, that the right to communicate and share data gets lost. We also talked a lot about the influence of culture and language on our ability to set priorities, and the fact that many times our cultures and how we communicate, the language we use to communicate about things varies so substantially that we think we're talking the same language, but we actually have very different nuanced understandings of the same words. And the example that came up was behavioral health, and that within the context of adult care, that may mean chronic disease self-management, self-efficacy, et cetera, which is a very different meaning for behavioral health than one might be thinking with substance use or services, et cetera. We talked about some issues related to healthcare technology that are growing amongst the public because of data breaches. And so a fear about how the data is going to be used, a fear about data being lost, the stigma that then comes with universal screening, and the concern that if I mention I have mental health issues as a parent, does that mean my information is now in a system and may go somewhere where I don't have control of it? We talked a lot about ethical issues related to data measurement, and felt like that was actually an important area for us to focus on as a group as a whole. We talked about the challenges of data integration at the individual level within the context of behavioral health carve-outs and what that means in terms of having systems that can talk to each other. We talked about the lack of financing, how data sharing requires infrastructure, time, and energy, and right now there's no reimbursement for that. So who is going to be entering data, who's going to be cleaning data, who's going to be making that data accessible? And the topic came up that families may be able to enter some of that data, but do we really know what families want, and how do we help work with them around their needs with respect to data, their concerns about data, and build their trust? With respect to recommendations, we focused at the systems level and talked a lot about how important it was to have different systems at the table when determining data collection approaches and data terms and measures that would be utilized, so that there's a shared understanding and a shared approach. Workforce development and training to understand cross-sector approaches seemed pretty critical given that huge obstacle of cultural differences that we felt existed. We also talked about some things we thought would be helpful to see coming out of HHS, one being an executive order to prioritize measurement and assessment, another being an office specifically focused on child health, and a third being, it's been a very long time since we've had a White House conference on children and youth, and what has happened to kind of the fervor we had in the first half of the 1900s around really improving services and approaches for youth. We talked about bundles of measurement and how that would be important as a systems perspective, and we talked about, as we move forward in discussing the ACA and where it's going, the critical nature of thinking about how ACA reinforces the things we're pushing for around measurement. We had a number of recommendations that came out around the family, and part of that was, can we frame measurement in a way that makes families feel that they own it and trust the process? And is there a way to have families engaged in entering the data and using the data where you're jointly as a provider, service provider on whatever setting you're in, negotiating and working around that data? And that allows a building of a culture where there's some self-learning on the family's part, and you're using the measurement tools as a way of learning and also building the relationship, the healing relationship. We also thought it was important in the way that a lot of systems are fragmenting in terms of who is the care provider, that we need to keep building the team culture concept, so that if any person in the team talks to you, we're all a part of the same process, and we're all a part of the same data collection effort and the use of these measures with respect to you and your child's well-being. We talked about the need for data that looks at access, and is access happening for care happening in the context of when it works for families. How do we help adolescents transition into adult care models and take them into account and build their ability to both access and understand and utilize and take control of their own health information and mental health information? And again, having a theme of strength and resiliency and the fact that parents want to support their children as opposed to a more tension-oriented us versus the family approach that can sometimes happen. Last, we talked about the need for more public use measures, the challenges with assessment tools that are copyrighted, the ability to leverage a single set of tools and try to find a one-size-fits-all tool within the context of developmental needs, et cetera. And learning and looking at other countries and cultures that are actually doing a good job at measurement at the fraction of the cost that we are. Developing common measures that can be used across policy, practice, and research settings. And then, again, this issue of common language continued to come up, and the idea was put forward that maybe we start with something like the HRQ lexicon and work to develop it further across domains and sectors. So I would like to open it up to the group to say if there's any other comments that they wanted to stress or bring up that I didn't go through in that blitzkrieg series of bullets. Great.
Thank you very much.